Today we are going to talk about narcolepsy. Narcolepsy is a condition where your brain can't control your ability to sleep or stay awake. People with this condition often fall asleep during the day, along with other symptoms. While this condition is serious and disruptive, it usually responds well to treatments. With care and precautions, it's possible to manage this condition and adapt to its effects. Is narcolepsy. Narcolepsy is a sleep disorder that causes an urge to fall asleep suddenly during the daytime. That's almost impossible to resist. Although this condition isn't common, it's widely known because of its symptoms and how they happen. Narcolepsy is usually treatable, but the condition can still cause severe disruption in your life, ability to work, and social relationships. Symptom of narcolepsy. There are four main symptoms of narcolepsy, but most people with this condition don't have all four. The four symptoms are: first, excessive daytime sleepiness. This symptom happens to anyone with narcolepsy. People with narcolepsy and experts on the condition often describe this as sleep attack. Second, sudden muscle weakness, cataplexy. This can have mild effect, like affecting one side of your body or causing only like muscle weakness. Third, sleep-related hallucinations. This happen live after falling asleep or right before waking up. Fourth, sleep paralysis. When you have this symptom, you will wake up sometimes fully but not always, but find yourself unable to move. Narcolepsy affects my body. To understand narcolepsy, it helps to know more about the way the human sleep cycle works. Stage 1, like sleep. This short state benign, like after you fall asleep, and account for about 5% of your total sleep time. Stage 2, deeper sleep. This state is deeper and make up about 40 to 50% of all the time as you spend sleeping. This number goes up as you get older. Step 3, slow wave sleep. This state makes up about 25% of the time you spend sleeping. Number grow down with age. It's very hard to wake someone up in stage 3. And waking up directly from its usual cause, sleep into tears, a state of mental fog and slow thinking. This is also the state where sleepwalking or sleep talking typically happens. Fourth, REM sleep. IM stands for rapid eye movements. This state is when you dream when a person in IM sleep. You can see their eyes moving, brain at the eyelids. If you don't have narcolepsy, you typically enter state 1 when you fall asleep and then move into state 2 and 3. You cycle between this state and ultimately go into IM sleep and start dreaming. After the first IM cycle, you start a new cycle and go back into state 1 or 2. One cycle normally lasts about 90 minutes before another begins. More people go through 4 or 5 cycles per night, assuming they get a full 8 hours. If you have narcolepsy, your sleep cycle doesn't happen like that. Instead, you will go into IM state shortly after falling asleep. The rest of the night, you will sleep only in a short stretch, often without going through the typical sleep cycle. What causes narcolepsy? The cause of narcolepsy depends on the type of narcolepsy you have. However, they all have linked to your hypothalamus, a specific area in your brain that helps regulate your sleep and wake time. About 90% to 95% of people with type 1 narcolepsy have a specific genetic mutation. However, about 25% of all people also have this mutation but don't have narcolepsy. As a result, experts rarely test for this mutation and they aren't certain what role it plays. There are also some evidence that this condition lands in family as having a first-degree relative, a parent, sibling, or child with narcolepsy put you at higher risk for. However, people can also develop type 1 narcolepsy after certain viral and bacterial infections, especially strains of H1N1 and bacteria like those that cause strep. Experts suspect that because infection can sometimes trigger change and malfunction in your immune system. Type 2 narcolepsy. While experts know much of why type 1 narcolepsy happens, that's not the case with type 2 narcolepsy. Experts still don't fully understand why type 2 narcolepsy happens, but they suspect it happens for similar reasons like a less severe loss of the neuron that use orexins, or a problem with how orexin travel in your. Narcolepsy isn't contagious. You can spread it through or catch it. How is narcolepsy diagnosed? A healthcare provider can suspect narcolepsy based on your symptoms. However, narcolepsy shares symptoms with several other brain and sleep-related conditions. Because of that, the only way to diagnose narcolepsy conclusively is with specialized diagnostic tests. Tests will be done to diagnose narcolepsy. First, sleep study, polysomnogram. Second, multiple sleep latency test, MSLT. Third, maintenance of wakefulness test. Fourth, spinal tap. Management and treatment. How is narcolepsy treated? Narcolepsy is treatable but not curable. Treatment usually starts with medication, but change to your daily routine and lifestyle can also help. Possible medication for this condition include first, wakefulness medication. These are usually the first line of treatment. Examples of this drug include modafinil and amlodipine. These medications stimulate your nervous system, which can help reduce the severity or frequency of daytime sleepiness. Amphetamine and amphetamine-like stimulants. Sodium oxybate. This drug can help you sleep and also reduce how often your cataplexy happens. Most countries control this drug very tightly because of its effect, but it's still used frequently of treating type 1 narcolepsy. Complication type and effect of narcolepsy treatments. Many medications that treat narcolepsy or its symptoms are more likely to interact with other drugs, high blood pressure, hypertension, and irregular heart rhythms. Thank you for watching and listening.